I'm going to be doing a subcostal tap block today, so I'm going to review my patient's chart before going into the room. I'm going to be looking at any abnormal health history, height, weight, allergies, coagulation, platelets greater than 100,000. Go into my room, introduce myself. Hi, my name's Adam. I'm going to be your anesthesia provider. We're going to be doing a subcostal tap block. It's a transverse abdominal plane block. This is going to be for pain management during your abdominal implant surgery. You're a 30-year-old male, no other comorbidities. Some risks of this would be a punctured bowel or peritoneum, bleeding, and infection. This is going to allow us to reduce the amount of pain meds we have to give during surgery and after. It's going to reduce your pain post-operatively, and we can do this under general anesthesia, so you won't even know we're doing this. If you don't want this, then it will just increase the amount of pain meds we have to give to you post-operatively, and that comes with side effects of opioids such as nausea, vomiting, and constipation. If this is something you want to proceed with, we're going to get a consent form signed. Okay, we did that, so I'm going to gather all my supplies. I'm going to grab 2 syringes with stopcock. I'm going to grab my 22 gauge Stimuflex needle, my normal saline to hydrodissect. I'm going to grab my sedation meds. I'm going to do 2 milligrams of Versed and 30 milligrams of ketamine. I'm going to grab 0.5% ropivacaine. Going to be doing 15 cc's on each side, and my sterile gloves, my ultrasound probe cover, ultrasound probe, and prep. So I gathered all, and I'm going to grab an assistant to help me out with this, and of course my ultrasound. So go back into the room. We're going to get my patient hooked up to all the vitals. Just the normal stuff: blood pressure, cough, EKG, and SpO2, and tidal. We can do this after induction, so all the vital sign monitors will be on them already. We'll do a timeout, identify the correct patient, procedure, block, and sides. It's going to be bilateral today. And then we're going to give my induction meds or sedation meds. Right now I'm just going to do sedation, so this is going to be 2 milligrams of Versed, 30 milligrams of ketamine. And so then I'm going to position my patient. They're going to be in a supine position. They're going to be induced already. So I'm going to put on my sterile gloves. Open up my sterile supplies. I'm going to clean them off. Put my ultrasound probe cover on with my assistant. I have some gel in there. And then I'm going to place my ultrasound probe with the indicator positioned medially. I'm going to be looking for the linea alba, just that fascial line in between the 2 rectus abdominis. I'm going to scan laterally and inferiorly, and I see rectus abdominis, and then I see transverse abdominis. I see peristalsis inferiorly. Don't want to go that deep. And then if I scan laterally, I can see the external oblique, internal oblique, and transverse abdominis. So what I'm going to be shooting for is a semilunaris, and that's the fascial plane in between the rectus abdominis and transverse abdominis. So I'm going to take my needle, and I'm going to be going from a medial approach, medial to lateral approach in plane. I'll have my assistant aspirate, hydrodissect, split that fascial plane apart, and then inject 15 cc's of 0.5% ropivacaine on each side. And then document and continue to monitor my patient throughout the procedure.